right, hi everybody. Come on in. We're going to get started here momentarily. Going to give a few minutes here for some folks to trickle in. I'll do a brief intro and then I will get out of the way and let Michelle do all the fun stuff. So we are in a Zoom meeting. We are going to be recording this session if you didn't see the alert, just so everyone is aware of that. And this is our first session of 3, sponsored by Walgreens. And thank you to Walgreens for being such amazing partners. Lali and Michelle, who are here today from Walgreens, thank you all so much. We had our custom magazine on the Feel More Like You program that Walgreens puts on that is extremely important to so many cancer survivors, not just in the adolescent young adult space, but adults as well and people of all ages. It has been an extremely important resource for so many individuals. So we are honored and excited to be able to bring it to the Elephants and Tea audience, the young adult crowd, a little bit more here today, digitally. So without further ado, and I guess I should mention too, if you don't know who I am the executive director of Elephants and Tea. I am notoriously not introducing myself. So as I mentioned, Michelle Rahman is here. I see Michelle. I said it the other way after I asked you twice. But Michelle is here. She's going to lead this session, and then we'll talk more about the next 2 at the end. We have 2 more sessions as part of this 3-part digital series. We'll also drop a link in where you can find the digital version of the magazine if you haven't seen it yet. And with that, I'm going to step aside and highlight Michelle, and she can take it from here.
Great. Thank you, Nick. Hi, everyone. Good evening. Thank you for having me today. I'm excited to share with you and be part of this program today with Elephants and Tea for our Walgreens Feel More Like You. It's a unique service, that helps you feel and look more like yourself. So through your individual journey, finding out, yourself during and after cancer treatment. So we're going to take you through some different types of slides on what the Feel More Like You program is, along with some suggested safer options for you to look for when you come into Walgreens or utilize our Walgreens.com to kind of take that journey on your own personally on what options are out there for you to select for those visual changes that are happening through the side effects of cancer. So, of course, it's just my slide. Y'all can see me. I've been with Walgreens for about 7.5 years. I am a regional beauty and wellness consultant that oversees the Texas and New Mexico market. There are 14 of us out here in the supporting role with Walgreens. And then we'll kind of share with you what is available to you individually to you in your locations with Walgreens through our side effects through cancer, whether it's clinical or whether it's through those visual changes through that journey that you're going through. So Feel More Like You, I don't know if anyone is familiar with that. I mean, feel free to put anything in the chat. We'll have some Q&A section as well at the end of the session today, just to kind of answer any questions for you. But Feel More Like You is really an individual approach for us to provide you a service that is either right there in the personal, area of your home, or whether you choose to find the right Walgreens that has that beauty and wellness consultant to support you in those visual changes. But every single Walgreens pharmacy has a trained specialist, which is our pharmacist. And then, of course, we have our specialty pharmacy. This is a unique program and approach that helps you manage both internal and also external through those visible side effects of cancer treatment. And everybody's individual journey, whether this is your first, time going through your treatment, your second time, or maybe you're in between that treatment, everybody's journey is unique and different. But what we're going to really give you today is just some guidelines and some additional information to help support you, whether it's through our side effects through a clinical team or through our supporting team in the front end through our beauty and wellness consultant. And, they receive specialized training. We train our beauty and wellness consultants on how to guide you through your journey through those visual changes that don't always necessarily help you feel like yourself. And we want you to really feel more about who you are, feel more confident, have a lot of those skin and different types of visual changes that are happening through those side effects. But also being a pharmacy first, which is who we are since, many, many years in 1901 with Walgreens, our pharmacists are always specially trained when it comes to those questions you might have through the side effects of your medication and your treatment. And then also it's a service for your loved ones or your friends, your family, whoever is your personal caregiver, to really help support them as well. And the service is totally free. And there's no appointment needed. You can just walk right into Walgreens. You can check in with our store managers. You can check in with our pharmacy team and really help guide you on where you can have that additional support to you as a patient, whether you are going through our prescriptions or even as a customer through the front end. So where do we begin is to get it right. We really worked with two main supporting companies. And one of the companies that we really made sure that we had an extensive amount of experience in pharmacy and beauty care, we knew we had to find organizations to work with and to provide training to our team members, which would need to provide the right support and guidance. So we used the cancer support community, and those, some of you might know who they are. They are a dedicated support community that's for all people impacted with cancer. They're empowered by knowledge, strengthened by action, and really sustained by community. But Look Good, Feel Better, it's been around for a very long time. It's a free service that is offered to the community for those individuals with cancer to really supply you with a global cancer support program dedicated to improving your quality of life, whether it's through loss of hair, skincare needs, makeup application, really helping build a quality of life and your self-esteem. So by working and partnering with these two different support communities, we have now have been able to provide you with our Feel More Like You services. So within our Walgreens opportunities for you, we launched this in a few stores back in 2018, and it's really grown. We have over 12,000 trained pharmacists, including our specialty pharmacy locations. And we have around 3,000 trained beauty and wellness consultants all across the country. So no matter where you're located, we'll kind of share with you later, like where you can kind of find these individual services through our Walgreens app or through walgreens.com. And then, we also have specially trained team members. Whether you walk into a Walgreens, you can talk to that store manager, talk to that pharmacist, just to really help guide you to where you can find that trained beauty and wellness consultant within these locations. So within our walgreens.com, not through the Walgreens digital app, if you go to walgreens.com/feel more like you, you'll see here at the end of the presentation some different options that provide you through clinical needs or through those visual needs that is really there to support you at the privacy of your own home. So our beauty consultants in select locations, they did receive extensive specialized training for a variety of visible changes. And we want to ensure that we have the ability to really provide you with a resource there right at the fingertips, whether you're at home or walking into a Walgreens. So our specially trained beauty consultants really provide you with an individual service through makeup tips or through skincare tips, all the way from the scalp to the face to the body, wherever you might be needing help with hair loss, dry hair, dry scalp, dry skin, skin discolorations, the need and necessity of finding the right sun protection, and then changes to the nails and cuticles are just some of the areas that we support you in. So we really like to help you feel better on the inside, and that's where it comes to our clinical side, and that's our pharmacist. And our pharmacist, Alex, is actually going to be on another call, the third session on October 30th, to really help support you through those clinical needs. You might have things about nausea or vomiting, skin rash, lesions, increased fatigue, mouth sores, dry mouth, even changes in discoloration in the nails. So through the support of your doctor, your oncologist, we also have the support through the clinical needs of our pharmacists in all locations with Walgreens. So some of the common physical changes that we train our beauty and wellness consultants are a few here, at the top, which is going to be changes due to occurring in that disease state or treatment that you're in, and that can be hair loss through scalp, through facial, weight loss, weight gain, facial puffiness, fluid retention. There's also certain guidelines and steps you talk to your oncologist or doctor about that fluid retention and not the need of do a microcirculation type of treatment. Changes in skin pigmentation, color. I hear a lot through different programs that I've been in, whether it's been a cancer treatment facility or another Elephants and Tea program, but is the yellowing or the sallowness of the skin. Dryness is a big extreme concern. Itchiness, flaking, or peeling of the skin. Changes in nail texture, appearance, and growth rate. Even mouth complications, which would be more of a clinical side effect that we would then provide you that warm transfer to our pharmacist in our store locations. Dry mouth, sores, dental cavities, and then increased risk of infection. So we'll talk to you today a little bit about hygiene and how to really make that a priority. But when it comes to those risk of infections due to treatment, induced low white blood cell count, that's going to be, again, part of that clinical side with our pharmacist. And again, October 30th, we have Alex supporting us on a lot of those questions. I think that'll probably arise today. So we do encourage you to definitely register and sign up for that. So here we'd like to do just a quick poll. An anonymous poll, just to find out, have any of you experienced one or any of the following experiences and changes within hair loss, weight change, changes in your skin, changes in your nails, mouth issues, increased infections? So go ahead and feel free to fill out the poll, and we'll kind of see where we are with that % of our attendees today.
And just jumping in for everyone, I see people are filling out. Perfect. Let us know if you have any issues, but you should see a pop-up on your screen right now to pick as many of those experiences as Michelle stated. And we'll give it a few seconds here and push out the results to everybody.
Yeah, so far, definitely hair loss. I hear a lot about dry, itchy scalp is a big concern that comes up a lot. We've got that weight gain, weight changes, loss, facial puffiness so far in the top 2, along with mouth issues. So, there's mouth issues, that dry mouth sores and more cavities. That's going to be more of a clinical side of our program with our pharmacist, or even, consulting with your doctor. It looks like those still seem to be more of the top 3. So we have a big portion today on hair loss. So I think that, with that being some of the experiences that you've had, hopefully we'll kind of find some ways for you to have that feel more like you experienced today with this program, and have an understanding of what things you can look for when you're in Walgreens or through the app or through Walgreens.com to kind of find those areas of support for you. So our top 3 still fall within those. So facial puffiness, hair loss, and weight gain. When it does, again, for facial puffiness, again, we always do ensure that we have the availability to provide you with that conversation and consult with the pharmacist when it does come to those needs of facial puffiness, but really ensuring that you are talking to your doctor with that. Same with the mouth sores, but I'll definitely be able to find some ways to provide you with skincare needs and then scalp needs for that hair concern. All right.
I'll go ahead and end the poll, Michelle, and I can share the results so everyone can see.
Thank you. Okay. So this is such an important piece. Hygiene, we sometimes think, oh, well, I know how to do this, but I just want to make sure I, really reiterate the importance of hygiene, particularly when you're going through, whether it's radiation, you're going through chemotherapy, different side effects of your medication. You are at a higher risk of infection due to treatment. So we want to really make sure we reduce the chances of spreading bacteria and infection. So some of the things that we always ensure that we follow up on is, of course, wash your hands, right? Make sure you wash your hands before and after applying any skincare or cosmetics, even if you're going from scalp to face to body, washing your hands in between, and never really sharing any cosmetic applicators. And while we're talking of applicators, we do encourage more of a disposable applicator. You can still use brushes. However, brushes can be very contaminated. They carry bacteria. So there's a big process in keeping those clean after each application. And disposable applicators are really a safer option because they're used once and then disposed of. Fingers clean. Maybe use a spatula, a Q-tip if things are in a jar, if anything is a pump version, keeping the pump clean from anything that gets a little dried up in there, keeping the outer side of your jars clean, the lid clean, tightening those really well. Cotton rounds, cotton balls, things like that are more important when it comes to certain applications of any type of liquid products. Replacing anything recommended by the manufacturer date. So certain items have an expiration date, but it's also dependent on when you open it. So on certain products, you'll see kind of an open hat box and it tells you like 6M. That means once it's opened by quality standards, it's 6 months quality guaranteed. However, keeping things not in the sunlight, not keeping them exposed to extreme heat or extreme cold, replacing also your makeup and skincare items if you're going through another treatment. So if you've been through a treatment, you're kind of in between and you're getting yourself, back to a normal state, working your skincare regimen, your cosmetic skincare, whatever it might be, and you now have to go to a secondary treatment, you want to make sure you're disposing of those items and repurchasing. Patch test items, hand or wrist, jawline, or an inconspicuous area to make sure, and always consulting also with your doctor on key ingredients and specific items of brand names. This one I don't always get, but I have heard of this, is not adding water to mascara. That is a big no-no. Don't pump the mascara. It adds air, it breeds bacteria. Mascaras normally I recommend of every 2 to 3 months. I'm going to definitely say let's do every 2 months. Don't try to extend that mascara. It may still be good, but it houses bacteria. So don't share your mascara. Don't share your applicators. Don't share your products with anyone. But definitely not adding water. And then check with your pharmacist and your doctor for any potential adverse reactions to cosmetics or drug products. Let's just checking the chat to see if there was anything in there. So hair was scalp or dry itchiness was one of the areas of concern and experience during our poll. So alopecia is considered hair loss, and that is a common side effect of cancer treatment. It can be on the head, parts of the body, primarily lashes, brows, and scalp. It affects typically are reversible, not always, and the hair growth may take several months to a year after treatment ends. And hair that does grow back can change in texture and thickness. The causes are an attack of a fast-growing cells, cancer cells, that are, harming that healthy cell that helps hair grow. Hair is at the health of the scalp, at that hair follicle. Chemotherapy is alopecia occurs about 65% of patients. And again, most common is on the hair of the, the head, and then also brows, eyelashes, and so forth. And then hair loss due to radiation only affects parts of the body treated with that radiation. Immunotherapy or hormonal therapy are more likely to cause hair changes or thinning. A type of treatment and dose is if hair loss can be expected, but not all cancer treatments cause hair loss. So everybody is always at a different stage within their cancer treatment. So the impact it's emotional, it's physical. I know I don't have to speak to this if you're one that has experienced this, which it seems like most of you have. You or your loved one may feel they don't look or feel or look like themselves. It's the most impactful. And, scalp and facial hair are considered key elements of good health. It's your identity. It's your personality. It's who you are. It identifies to beauty and youth and social communication. It's one of the most visible adverse effects that people see and make that assumption. It, can affect adverse effects through both male and female patients. And it's very emotional, physiological, socially devastating. You don't want to get out, feel like people are going to judge you, treat you differently. Maybe at work, they treat you differently. You may feel physically affected, embarrassed, depressed through that hair loss. And chemotherapy-induced alopecia has a significant impact on self-esteem, your relationships, your body image, your sexuality, your overall quality of life. So care tips during treatment. Some things are to keep the hair short. Maybe you want to shave your head, wear a scarf or turban, wear a wig. But it's very, very important to wear a mineral sunscreen to really protect. It is skin, it's the most exposed. Stick with very gentle, fragrance-free shampoos. You're going to hear of things like glycerin or hyaluronic acid. Be gentle, massage the scalp, not intense pressure. Pat the head dry versus rubbing. Ensure you are lukewarm, not real long showers or baths. Style it gently. Find yourself the right brush or comb. Gentle conditioners, things that are nourishing and hydrating that are going to condition. Even if you have a loss of hair, minimal hair, it's still important to keep the scalp treated. Really try to eliminate heat styling tools, particularly like blow dryers, curling irons, chemical dyes, hairsprays, particularly with alcohol, hair rollers, any bands or clips that are going to be extensively pulling and tugging. Maybe there are silk pillowcases, different things that you can do to really have a better quality of sleep. And then always that sun protection, a hat or a scarf. And the best support to sun protection is a natural mineral. It's an immediate protection. It's not a chemical. It's not penetrating into the skin. It stays on the surface of the skin. And again, we're going to always talk about talking to your doctor or your pharmacist for more information for that internal health through vitamins or supplements, even including some additional needs for creams, lotions, or hair growth. So some things to really help be more protective for the care of the scalp is skin. So always ensuring you have your head covered when outdoors, even indoors. UVA radiation cuts through glass. UVA radiation cuts through clouds, even if it's a colder climate. If you're in an icy, snowy, even sand, cement, it's more reflective. Keep the head warm as much as needed. If your scalp itches and feels tender, hair oils are always a good facial oil as a hair oil or a scalp oil. Things that are conditioning, once again, glycerin, vitamin E, chamomile, things like ceramides, but hyaluronic acid is always a good go-to. We even have an oil with botanics, which is a natural plant-based line that's organic. There's always a big win among our cancer patients that we've presented to or have had provided some different items to try. Scalp cooling is something you can do through talking with your doctor through FDA cap cooling, different types of treatments that you can talk to through ovarian or prostate patients as well has been very successful. And then medications. So minoxidil, which is an over-counter topical treatment for hair growth. So again, just really talking with your physician and your doctor on any of these things that might be more medicated or chemically treating. Now, after treatment, once the hair is growing back in, same kind of similarities, being very gentle, limiting the hair washing to maybe 2 times a week, gently massaging and conditioning the scalp on a regular basis. A wide tooth comb versus a brush, limited, again, heat styling, avoid permanent, semi-permanent hair chemical treatments, avoid cutting or straightening. And then again, any types of tight pulling from hair bands to weaving or braiding. And then hair often through after chemotherapy, everybody's journey is different. It could grow back in 2 to 3 treatments. Again, keeping up with your doctor, your physician, and talking about what's the best next steps for you when it comes to that overall hair growth. So I'm seeing if there was any questions yet in the chat. Not seeing anything yet. So this is where I'm going to provide you all with some insight and give you a demonstration on brows. So brows, it's one thing that maybe you weren't comfortable with prior to your treatment and hair loss. However, maybe you were comfortable and now you're like, I have no brow, I have minimal hair brows. How do I shape my face? This is your true personality. And the one thing I have to say is that brows, you can be whoever you want to be. You find a picture of someone that you want that brow. Now it is your turn to become that look. Be that person in your own way, whether it's feeling more like yourself, creating your own persona, your own personality, your own identity. The brows really truly shape the face. Whether you choose to wear a wig, you wear a headscarf, whether you choose to go all natural, that brow is really going to create that shape. And so brows, I'm going to share with you, how do you find that brow? So here's where we're going to do a quick demonstration. So hopefully if with my mirror, I can share with you. So I prefer more of a micro brow, something that's an angled, creamy texture. If you have some hair still left on the brow area, a powder can work. Nothing really permanent. They have waterproof kind of tattoo. They're going to be a little harder because if you make a mistake, it's harder to remove it. There's also different stencils that are available out there for different brow shapes. But I'm going to give you just kind of the basic application. So I have the NYX Micro Brow, and you can see it is a very thin applicator with also a spoolie on the other end. So if you do have some hair, you have that availability to kind of blend it and shape it. So if everyone would like to go ahead and participate, take your finger and take it right under that brow bone, right where that bone is, kind of that inner socket. And then if you roll it up, that is exactly where your natural brow would be. You can take the tip of your brow pencil and kind of do a little dot to know where you're going to have that brow. And then once you've gotten that dot and you have your finger here, maybe do a little dot here and then a little dot on the outer edge. So now you kind of know start, middle, and end. Have your pencil available. And what you're going to do is you're going to take that pencil wherever that original dot is, and that's where you're going to start that brow. So take a little dot. Then you're going to take from the nose right above the right outside the pupil, and you're going to get that arch. So far you can see I have my arch somewhat where it should be. Dot it. And then you're going to take it here and then dot where you want to end that brow. And you don't want to go downward because you don't want your eye to droop. You want to kind of go outward. So once you've gotten that, you're going to take, and I've actually dotted myself, you're going to kind of start kind of shaping that look here. And I'm just going to kind of take what I have now and get that rise there to that dot and then kind of take that angle down. Don't worry, it's easy to remove. Micellar water, a little Q-tip, cleanse it off. And then you're going to start kind of shaping in here. And then you want to take that brow line like this. You want to go higher up here and not go down. You don't want your brow down here. You want to keep that one kind of like right where it should be. And just kind of start shaping hair-like strokes. And then work that brow out. So I'm going to just kind of work on my own brow. And brows are like sisters or twins. We look alike, but we're not exactly alike. So don't worry if one brow looks different. You're the only one that's really noticing that. And so now what I've gotten here is I've got my brow shape, but you can see I have a few mistakes. So I can just take a Q-tip, kind of work those mistakes off. You can get a highlighter, concealer, pencil, and really kind of help shape around there. To see how easy that was for me. And then if you have some hair, just kind of start shaping it. So now you can see I've got my brow done. Did anybody try it? Let me know in the chat.
And Michelle, we do have one question in the Q&A. What do you recommend if your eyebrows never fully grow back? All the semi and permanent options are confusing, expensive, and a little scary.
Yeah. So I would suggest that you stick with, if they're not growing back, again, a pencil. There's pomade pencils that are really soft and easy. Once you get more confident and comfortable, there are different brands that have a waterproof semi-permanent. I mean, it's going to wash off with makeup remover, but some can stay on for 1 to 2 days. But definitely getting yourself a stencil to really allow you to get the shape and style that you want. I find that's the easiest application. But talk with your doctor because during treatment, we do not suggest any type of serum, eyebrow, lash treatments. There are things like Latisse that's out there in the industry that creates new growth. But I'm going to say definitely talk to your doctor. But when it comes to treatment for the lash, There's a number of brands that have things like with ceramides and different ingredients in it that actually helps strengthen the existing brow and lash that you have. As we get older, they become gray, they break, they become brittle, just like our hair on our head. But that's suggested during treatment not to use those products. But again, always consult with your doctor because they're going to know what's best for you. So how do you determine? Good question. Darkest root of your hair. So you can see the girl on the screen is gray hair, but she's going with a darker kind of brown. So there's dark brown. Mine is an ash brown. There is a deeper brown, but it becomes a little bit too intense for me. If you're a redhead, there are options if you prefer. Even if you don't have hair, you want to have a red brow and you want to become a redhead with your brows, you go ahead. So if you have a total hair loss, stay within your comfort zone. There are also options for gray hair. There's black, there's brown, there's auburn. So there's a different options, but you can kind of pick and choose. But if you have your hair growing back or you still have hair, it's always the darkest part of the root of your hair. And if you're not comfortable, do one brow first. So you look at yourself in the mirror in kind of an upward motion and analyze how your brow looks, because you're going to find that side with the brow, you're going to be extremely happy. You're going to feel very confident. You're going to be very comfortable with it. If you do both brows at once and you're not used to it, you're going to feel like it's too much. So it's more normally about the hair, but I think for skin tone, if you're really fair, stick with a light brown and auburn. If you have darker skin tone, definitely a black or a dark brown. Nothing real light. It depends on kind of how much you want to, express your personality with your brows, because that's your expression, right? So if I didn't have a brow versus a brow, it would definitely look different from one side. And it really does shape the face and draws those eyes, draws to your eyes, to that, to who you are. So lashes, one for each brow. All right, love it. So, hey, you know what? Go for the glitter. I say NYX has all their glitter and glam. We've got so many fun brands there that you can just, like I say, it's coming up to where you can have whatever you want. But hopefully that helped for your application, because when you don't have a brow, I can say even me applying a brow to somebody has a lack of brow, it's the same kind of technique that I'll use if I'm applying it to somebody directly. So mascara, no, I wouldn't suggest a waterproof. Remove it completely. Micellar water cleansers are the best bet. So gentle, so effective. They're gentle. They remove anything that's not needed at a cellular level. With a cotton round, they actually dissolve versus having to rub. If you still have some lashes left, you want to stick with things like with argan oil, hyaluronic acid. Those are going to be nourishing mascaras. Try to steer clear of waterproof. Again, always purchase a new tube with each treatment. Purchase a new tube every 2 months at the least. False lashes you can do. It's really your preference. However, if you don't have a lash, it's hard for a lash line. Plus, the glue or the adhesive can actually be irritating and cause sensitivities. But it really is what your choices and options are that we can help you find what's best. Under lashes aren't going to be the best option because you don't really have the lash for it to connect to. But can false lashes be worn? Sure, but just be cautious of the glue or the adhesive. There are natural versions. There's actually liner glue now, which is in black or clear, so that you can line the eye and then just add adhesive, the lash to it, instead of having to put it on the lash itself. Eyeliner, liquid liner is going to be a bit more challenging, something to practice with. They're a little harder to manipulate, particularly if you are having no lashes. Here, somebody said not had them for, at least the brows for 8 years. So if that's affecting the lash as well, it's hard to apply a liquid without a lash line. Always do your liners before mascara, but I prefer suggesting a charcoal pencil, a really soft pencil, whether it's retractable or sharpening. Just know that retractable, just, clean it afterwards, spray it with some alcohol with the barrel upside down. So that way, when you roll it back in, it's clean. If it's a pencil, you can sharpen it and then clean it with an alcohol swab or wipe, just to make sure that there wasn't any bacteria housed inside the sharpener. I prefer more little strokes when it comes to the liner. I like a little smudge tip. I have an applicator for my brush collection, or some have the sponge tip on the side. So if you make a mistake, no worries, just blend it in. So this liner I have on today, it was not a straight line today. It's called smudging and manipulating the look to look like I did perfect liner. So any color that you prefer, black, brown, green, different types of shimmer. Just be cautious of anything that has a glitter kind of thing to it, could flake into the eye and cause some sensitivity. Depending on how you want to open the eye area, if you go all the way in on both, you're going to close the eye more. If you kind of just work it more on the outer eye, you're going to open the eye more. Or, no liner at all. It's really just the preference of how you want to create your look. Now, when it comes to eyeshadow, we prefer more of a cream. And the good thing is it's back. It is trending. It is hot. You've got balms, creams, from cheek to lip to eyes. You've got things that are multi-purpose, from lip to cheek to eye. Anything creamy. They're manipulative. They're easy to work with. You can't make a mistake. Powders can be very dry, particularly if you're really dry in the eyelid area. You can work with 3 shades to make it simple, an all over color, a base color, kind of like what I've done with mine today. If you can kind of see an overall color, lower lid, I have a little in the crease area. You just kind of start working and blending, and then something to highlight, which also is going to help kind of lift that brow bone a bit more. But a cream is really more preferable due to it's accessible and actually to work with more. It's not going to dry the eye. They actually have even like stick creams now, like Maybelline and L'Oreal have them. They're really fun colors, impactful, water resistant, long wearing, non-drying. So many different options out there, which there always hasn't been. They kind of come in trend wise, but I like the stick kind because I'm not sticking my finger in a pot all the time. Foundation. So foundation, the color is going to be based on where you want your look. Don't go too dark, don't go too light, kind of stay more neutralized. Full coverage matte, not the best option, particularly because your skin is dry, it's more delicate, it's more brittle. CC creams, BB creams, tinted moisturizers, things that contain ceramides and hyaluronic acid, things with shea butter, vitamin E. It's really going to be based on where you want your tone to look, but you're going to want to also possibly color correct. If you're redness prone, more yellowing of the skin, that's a pre-corrector. If you want to add color, add a bronzer. Physicians' Formula's bronzers are off the charts. They're creamy. It was a physician that created the brand, highlighting this area with a creamy highlighter. But foundations really help with providing you evening of the skin tone, creating radiance, more of a healthy glow. Elf has one, which is really good, like a CC cream. Neutrogena has one with hyaluronic acid. And number 7, one of our owned brands, has one with Hydroluminous, which hyaluronic acid. It's a beautiful tint. Nothing chemically in it that's going to cause sensitivity. There's a concealer and a lip balm that complements it. So you can kind of stay within that realm of product selection. Try to steer clear of an SPF in a foundation because it's more likely a chemical. Chemical sunscreen can cause sensitivity, burning, irritation. However, Aven is one of our dermatological brands, has a tinted compact sunscreen. It's not a foundation, but it's going to really even the tone. It's in a compact. We also have some that are more like a liquid fluid. CeraVe, or even our own Walgreens national brand equivalent, it's exactly the same as CeraVe, has some different options when it comes to sunscreen that you can apply with your foundations without sunscreen that are going to be a mineral. Concealers or color correction. Concealers conceal. So they conceal dark circles. Maybe you have more discoloration on the eyelid, under the eye, where it's more brown dark circles versus blue. You might have more reddening of the skin, more brown spots, maybe some darkening of the skin. So find color correction. There's color correction sticks, color correction creams, but there's also primers that are there for color correction. And those are normally, color correction is normally done before the foundation, and then concealing is normally done after. Because color correction is correcting it, then you help with the evening of the skin tone, blending the skin, and then adding in that concealer on areas you want to conceal and cover more. Hyaluronic acid, once again, it's going to be the ingredient of the day. Again, vitamin E, things with antioxidants to really protect any of those environmental exposomes that can cause sensitivity and irritation. Yes, so color correction, yes. So reddening skin, you're going to use green correctors. And what's good is color correction's coming back again. It was a big thing a few years ago. We kind of lost it in the cause section, and now it's back on trend again. Lips, I'm going to also talk about lip treatment. So lip products, steer clear from anything that's long-lasting, mattifying. Those are extremely dry. They dry my lips out. Things with hyaluronic acid, things with shea butter, argan oil, things with ceramides. You know, we have a lot of brands that are providing just a lip balm, CeraVe, Aquaphor, even La Roche-Posay has their Cicaplast, which has the Cicaplast hand cream, Cicaplast lip balm, Cicaplast healing wound healer. Anything that's going to be like in the Eucerin line, you'll find that even with Cetaphil, I think now our Aquaphor in our skincare section, there's a lot of lip balms, EOS. But when it comes to lip products, if you want to have a longer wear without drying out, find yourself a nice lip liner to really define the lip and fill in the lip, and then apply a lip balm, a lip gloss, something hydrating. Lip oils are really a big deal right now too. Nothing with a lip plumping action that can be very sensitive, very irritating and burn and cause a lot of flaking or drying. Even the Hydroluminous lip balm in number 7. You have a lot of lipsticks that have like a moisturizing middle that's really good for the lip products as well. Lip stains are very popular. However, I mean, feel free to try it. I have on today a double-sided NYX lipstick. It's a stain and then a lip gloss. But I do find sometimes if my lips are dry, it can cause peeling. You know, you can find things that are, oh gosh, it's from NYX and I just went blank. It's more of a creamy lip stain, but anything that's those long-lasting lip mattes that do not budge are going to be extremely drying. But it really is what you choose in your preference. A lot of times you can put like a lip gloss or lip balm over it, but it's going to prevent it from being a transfer resistant long wear. So dark circles, again, color correction, but any concealer that's going to be a little lighter than your skin tone. You don't want it too white. You don't want it too dark. Always ensure you're always doing like a pressing middle ring, the ring finger, always pressing out. You can use a disposable sponge, but always pressing out, little pressing motions. If you have some discoloration on the eyelid as well, you can use your concealers on the eyelid. Cheek color is going to be the same. Try to stick with creamy balms, creams or balms. There are so many balms out there. There's also cheek stains that are really creamy that are non-drying. There's one that just came out with, I think Elf has one, Revolution has one. These are all good brands that are clean brands. But there's a lot of options. Revolution has like a balm that is a bronzer, a lip tint, eye tint that you can use. And particularly if your skin's really dry, they're easy to manipulate and blend, and you can't overdo it. A lot of the cheek stains, you want to be very cautious, work with a little tiny bit and kind of press it in and blend it in. Use maybe a sponge to kind of manipulate it. If you get too much, you can always take a little serum or a little moisturizer and kind of blend it down. And we talked about makeup tools and accessory. I'm always going to suggest disposable, but based on your preference, there's a number of brush sets that you can find in Walgreens that provide you with the different tools. But again, always ensuring you clean them after every use. There is a brush shampoo that we provide with Walgreens' own brand. You can spray them also with alcohol to ensure there's no bacteria growth before washing them, and then letting them dry in between, keeping them laying flat, not together. Try to prevent putting all your brushes in a makeup bag. Keep them in like a container that keeps them upright when you're not in use. There's a container that has full of brushes that is with Walgreens, which keeps everything clean and hygienic. But once again, I do prefer and suggest always using those disposable sponges. A makeup beauty blender, definitely not something to think about because it houses so much bacteria. And you buy it, it costs more money, and then you got to throw it away. So disposable sponges, disposable eyeshadow applicators. You can even use Q-tips. What do I do with my Q-tip? You can do Q-tips. Listen, when I worked for Clinique, that's how we used to apply things. Do a Q-tip and kind of get it fluffy, and that becomes an eyeshadow applicator. You can take a Kleenex and you can take a cotton ball. And then if you want to be more hygienic with your different types of powders, we do this for applications in store. You take your ghosty and wipe it on the powder, and then your brush actually goes directly to apply these products. You take your brush directly to the ghosty, depending on how you want to apply it, and then you dispose of this, and nothing is touching the actual powders to cause cross-contamination. Cleansers. So again, anything to really help dissolve dirt, debris, pollution, and makeup. You also want to do a double cleanse in the evening. Even if you're not wearing makeup, you also have a lot of pollutants and dirt and debris that needs to be removed before you even get to the skin. And so anything in a micellar cleanser is always my suggestion with cotton rounds. That's going to dissolve any excess makeup. They're safe for eyes. You can get your chest, your neck, the back of your neck, even within the ear area. And then anything in a creamy, milky, there's cream foams. Gels can be a little drying at times. Even creamy balms that wipe off through using a warm, lightly warm washcloth. But again, not to overly excessively scrub the skin would be the best benefit for you. So you have hyaluronic acid in a lot. You have, try to steer clear of anything acidic, acid, active, salicylic acid, beta hydroxy acids, glycolic acids that can be very harming and irritating to your skin in that time. Afterwards in your treatment and your skin is getting back to normal, those can be some things to talk to your doctor about, how to really eliminate dry, dead skin cells to really create more radiance, more brightness to the skin. But cleansers, again, things that are very gentle to remove pollution, dirt, debris, and makeup. And that preps you for your night routine or your day routine. Toners, alcohol-free. I like La Roche-Posay, Vichy, or Avène water because they each have different properties of healing, calming, and soothing. They have prebiotic technology. They have minerals. They have calming benefits. So you just spray it on versus rubbing it on. It just really helps remove any pollutants or drying actives that might be in your water. Water, even though water is clean through the tap, it can really dry out the skin and have chemicals. So by providing something to pH balance your skin, it preps your skin for your skincare. And I've got to speed up a bit, I think. So moisturizers and skincare, I'm going to kind of keep all the skincare, body care, all similar. When it comes to applying your skincare, your medicating cream is always first. Then you would apply a serum, then a moisturizer, and then your sunscreen. Always a sunscreen in a mineral form. Again, same type of ingredients. We have Lipicar from La Roche-Posay, which is a prebiotic technology to give you a healthy microbiome. It has ceramides to really retain the skin barrier, keep it intact. Things don't get in, things don't get out. steering clear of anything that's exfoliating chemically and manually. So we have things that would be cortisone free for excessively dryness. We have things that are going to have zinc in it that are really topically hydrating. Different things like your ceramides. Squalene is a really good ingredient as well. So those kind of nourishing ingredients. You can look up a lot of this online too, to provide you kind of some insight of hydrating, nourishing ingredients. When it comes to itchiness, they do, again, mention the same types, but they do mention cocoa butter, oatmeal, colloidal oatmeal, things like Aveeno, things with oatmeal in it are calming and soothing. It's actually known to help with eliminate itchiness. It's also provided something that is provided to people with eczema. Avoid cornstarch, avoid loofahs, big bacterial growth. Anything scrubby, just stick with your hands is the best thing. There are so many hydrating and so many nourishing body washes and body lotions now available. A lot of naturals that are available. So those are a lot of the things that we can guide you in store to help provide you. You can also search things like this on Walgreens.com or the app. Same with eye products. Again, steer clear of anything like with vitamin C. Most eye creams all have caffeine, which is not caffeine like you drink, but it stimulates circulation. So again, consult with your doctor first. But anything that's going to have ceramides or even anything with hyaluronic acid, anything hydrating, Mineral 89 from La Roche-Posay is all natural, and all it has is 89% of their mineral water and hyaluronic acid. So you kind of want to look for things that are caffeine free. Botanics has one, but I believe it's a caffeine. But they do have things like with snow mushroom, which is a natural ingredient that mimics hyaluronic acid. And we talked about skincare, mineral all the way. There's so many options from 30 up to 40. You have it in your skincare, but providing it secondary is my preference. So you get the full-on impact. Don't forget about the ears, your scalp. There are brands that have a spray in. So if you still have hair, some of your hair left, you have ways to spray in scalp treatment that is sunscreen. And then nails, keep them trimmed. Be gentle when you file. Don't suggest going to a nail salon, using fake nails, glue. Make sure you find things like that are going to be a nail treatment. There's nail serums, nail treatments from Sally, from OPI. You can wear gloves when you're washing any dishes or use anything chemical to really keep your hands clear of any damage. And then for the feet, any nourishing foot creams. There's also foot masks. Just ensure there's nothing exfoliating to cause sensitivity. And this is when you see something like this, you definitely want to consult with your pharmacist or your doctor. There is a nail polish you can look for. It's a argan oil from Sally. But nail treatments, steer clear from anything that has a chemical, any nail growth products, and then acetone-free nail polish if possible. Cuticle creams are good too. So I'm going to pause here for just a second and see if we have any additional questions. I know we've been working the Q&A as we've been going through this. I know we made some time here at the end. But is there anything I'm not seeing, Nick, that maybe I haven't answered?
I see everything here. And also, too, if anyone wants to come off of mute and ask a question as well, you have that ability to do so. If we want to, Michelle, for something else you wanted to share, or keep this screen up here, I can remove your spotlight. There we go. So we can actually, if people want to turn their cameras on and ask questions, people can do so in the 5 minutes we have left here. And also, too, I'll put that walgreens.com/feelmorelikeYou link in the chat for everyone as well.
Yep.
Anybody have any questions?
All right, so we got very helpful. So while we're waiting, I did want to let you know we have an amazing resource right from the comfort of your own home. And this is from anything clinical, constipation, diarrhea, loss of appetite, some of those clinical side, again, just letting you know, don't forget about Alex, our specialty pharmacist. He's so great. I've been on a few calls with him October 30th. But from skin and nail changes, from skincare needs, if you want to dive a little deeper, again, that walgreens.com/feel more like you, only on the walgreens.com e-commerce. On the app, you can search store locations and different services that are offered on the Walgreens app, and it'll let you know if it's a beauty location. But feel free to always call a local location and they can help assist you. So this program has been around for, I would say, maybe about 5.5 years. I think I said earlier 2018, maybe it's been about 6 years. And again, it's, anything that we can offer to support you, we're here to guide you through your journey, to feel more like yourself, from, those hair, loss of hair, dry skin, just really assisting you in finding the right resources. And our pharmacy team is amazing. We're a pharmacy first, and, that pharmacist can also make recommendations for you too, if that location does not have that beauty and wellness consultant.
Michelle, looks like we have another question in the Q&A, which I think you've been kind of answering as you've been going along here, but do you have a resource online that tells you what order to put things on your face? I feel that stresses me out.
Yeah, I can understand that. It stresses me out too. And I'm a bit of a skincare junkie myself. So when it comes to facial skincare, it's always cleanse the skin. At night, make sure you double cleanse. Be very gentle in your cleansing choices. Then once you apply your cleanser and you want to choose like hyaluronic acid, like today I have right behind me, Rock just came out with a new hyaluronic acid plus hydration serum. Vino just came out with one. There's a number of Cetaphil just came out with one with Cica Madecasscoid, which is a healing. So there's so many options. So serum first, lightest to heaviest. So if you have more of a liquid serum, more of a creamier serum, lightest to heaviest, moisturizers always last, preferably a moisturizer if it has a sunscreen, a mineral, then your sunscreen is always last. If you choose not to do a treatment like a serum, then it would be cleanse, tone if necessary, moisturize, protect. In the evenings, you don't need the protection. So again, same process, cleanse, treat, moisturize, lightest to heaviest, dependent on the texture. Always feel the texture between your fingertips. You really only need things that are going to be hydrating, calming, protecting, nourishing, prebiotic, hyaluronic acid, squalene, vitamin E, ceramides, things like that are calming, argan oil. So if you do oils go on top of moisturizers. You don't need a moisturizer if you use an oil as well. All right. So go ahead.
No, go ahead, Michelle. No, go on.
I know we're right at time by 1 minute. I knew I'm a talker, guys. I'm sorry. And I have a passion, which makes it even more complicated. So here's some of the resources at home. I would suggest, if you have the opportunity, download on your phone and through your app process, Feel More Like You. There are 10 sessions. There's 5 on the first version and 5 on the other. It goes into depth, from hair loss to breast changes to sexual wellness and fertility, an intro to beauty and makeup and emotional wellness. You've got actual cancer individuals. You've got a pharmacist on there, specialty pharmacist. You even have a beauty and wellness expert on there. Even someone who's gone through an experience of chemotherapy and radiation through her experience with breast cancer. So I do suggest, when you have the time, download the app, on your app through Spotify, Google Play, I think Stitcher, and then Apple Podcasts as well. All right. Woo.
Thank you, Michelle.
You are welcome.
And if anyone else has any questions, feel free to ask them. To buy some time in case people are still thinking. You heard Michelle mention that we have another series, 2 more actually in this series coming up. The next one is going to be on October 16th at 7 p.m. Eastern time. For those that are familiar with our purgatories, we have patient stories. So 3 individuals are going to come on and read their stories that were a part of the special edition Feel More Like You with Elephants and Tea Walgreens. Aubrey Danielson, Michelle Lawrence, and Mawish Saeed are going to be our 3 amazing speakers for that. And Lisa Orr, who's not here today, our brand director, will be moderating that. So check that out. And then on October 30th, this is Alex, who Michelle has mentioned a few times. We'll be doing more of a Q&A to answer things from a pharmacist standpoint and have a bit of a presentation as well for y'all. So please come back to that. That'll be at 7 p.m. Eastern on that night. All of you have registered. You're into this one. You have access to those as well. We'll send out reminders for each of those. And don't forget to check out the Feel More Like You special edition from Elephants and Tea as well. I will drop the link in here for you to check out again. And as always, if you have any questions, even after the fact, you want us to relay to Michelle, please reach out to us. You know, our doors are always open and happy to do that. And we did record this. Someone did ask a Q&A at the very beginning. Will this be available? Yes, we'll make the recording available to anyone that is registered for this. So you'll be able to check this out. Or if you know anyone that was unable to attend, you can share that with them as well too. Cool.
All right. Well, thank you, everyone. I really appreciate your time and giving me the chance to really share this amazing program with you. Thank you, Nick. Thank you, Elephants and Tea.
Thank you, Michelle. Have a great rest of your night.
Have a great evening. Bye-bye.
Bye, everybody.